Assalamu alaikum. Good evening, everyone, and welcome to today's webinar titled Regenerative Endodontic Procedures. My name is Sanya Shahid, and I'll be your host for today's session. We are delighted to have participants joining us from across the country for what promises to be highly informative and clinically relevant discussion on one of the most evolving areas in modern endodontics. Before we begin, just a few housekeeping points. The session will be approximately 40 minutes long. Kindly keep your microphones muted during the presentation. You may post your questions in the chat box at any time. We'll address them during the Q&A session at the end. This session is being recorded and the recording link will be shared uh, with all the registered participants afterwards. Thank you for joining us today. It gives me great pleasure to be introduced our distinguished speaker for today, Dr. Farrukh. Dr. Farrukh is highly respected clinician and researcher holding qualifications in BDS and RDS and is the author of 20 research publications in the field. He is also the founder of Pride and Experience Dentistry, where he has successfully combined evidence-based practice and patient-centered care. Today, Dr. Farooq will be sharing his expertise on regenerative endodontic procedures, focusing on biological concepts, current clinical protocols, case selection, and how regenerative approaches are transforming the future of endodontic treatment. We are confident this session will provide valuable insights that you can directly apply in your clinical practice. So, without further ado, please join me in warmly welcoming Dr. Farooq. Dr. Farooq, the virtual floor is yours.
Thank you very much for the very great introduction, Dr. Sania. Okay, Assalamu alaikum everyone. I hope you all are doing great. As you all know that we have started a webinar series, and the topic of our webinar series is basically regenerative endodontic. This is a very new domain, a very emerging domain, I would say. Uh, and we will be discussing the second webinar today. The topic of the second webinar is regenerative endodontic procedures, stepwise protocols and clinical considerations. So we will be discussing stepwise all the protocols that are being applied in the regenerative endodontic procedures, and also all the clinical considerations that we need to make in focus whenever we are performing any regenerative endodontic kind of procedures. So without any delay, let's start. So this is a little bit introduction about me as the Dr. Sani has done it. My name is Dr. Mohammad Farooq, and I'm graduate of Magla Institute of Health Sciences. I am founder of both Pride as well as Experience Industry. Alhamdulillah, Summa Alhamdulillah, I have around 23 research publications with my name, out of which three are published in an international journal. Right now I'm running my own clinical practice as well with the name of Dr. Farooq Dental Clinic, and I also had a privilege of getting distinction in oral medicine in my undergraduate level. So today what we will discussing. These are all the learning objectives. At the end of the session, you will get to know all about them. First, we will discuss about the concept of regenerative endodontics. Then we will know what's which of the patient is basically ideal, and which of the case how do we do the case selection for this performing regenerative endodontics. Then we will learn step-by-step clinical protocols for regenerative endodontic procedures, and then we will understand the disinfection methods, followed by selecting the appropriate intracanal medicaments, understanding the scaffold induction techniques. Last time I did give a brief introduction regarding all these steps. Know commonly used biomaterials and identify clinical challenges and outcomes. The topic is very much important because regenerative endodontics has completely changed how we manage immature necrotic teeth, converting teeth once considered that was hopeless into maintainable functional teeth. Okay, why regenerative endodontics is important? Uh, because as I told that it has provided us now alternate modes of which we use the traditional problems. Traditionally, we used to treat these problems with the help of apexification. What apexification used to do, it stopped the root development. Okay, and then thin dentinal walls remained high. There was still the high fracture risk and no pulp vitality restored. But in the regenerative endodontics, which the current trends that we are following, it not only does the root completes the root development, but also makes the dentinal walls thick, and there is a less fracture risk, and the pulp vitality is basically the main thing is the pulp vitality is being restored. Okay, so you can see with this picture as well. Usually we used to apply the medication like calcium hydroxide, and which what it used to do, it produces a apical barriers for in the case of apexification, and it required several visits for this procedure. It took around at least 6 months to form apical barriers by calcium hydroxide. But nowadays, what we are doing is we are placing the MTA and other regenerative procedure protocol in which we place the scaffold, etc. It hardly takes around 2 weeks, 2 visits, and the apical plug is being formed. Okay, and the pulse vitality is being restored comparative to the old traditional method of calcium hydroxide. So why regenerative endodontics procedures? What are basically the our new jo regenerative endodontics aims to do? Regenerative endodontics aims to basically restore the vitality of the tooth, continue the root development, thicken dentinal wall. As I said, improve long-term tooth survival. Our goal is basically regeneration, not just repair. Okay, the main goal is to restore the pulp vitality, not just repair the tooth. Okay, so you can see in this picture, uh, tissue engineering is basically done in the regenerative endodontics with the help of these three main things. We have you can remember this with the 3S. We have scaffold, we have stem cells, okay, and we have signaling molecules or growth factors, you can say them. Okay, but these three all together help in restoring the pulp vitality. This picture is very much important. You can see how a regenerative endodontic procedure is being performed. Okay, so you must remember basically regenerative endodontics procedures are usually performed in the tooth with the open apices, okay, and immature teeth, in which the root has not been completed yet. So you can see in the periapical area here, the immature tooth with a necrotic pulp. The tooth had a necrotic pulp, dead pulp, you can say. And what we did, we did a traditional root canal stimulating the bleeding by over instrumentation with a file. Okay, we intentionally caused bleeding in this canal by placing our file more beyond the apex. आसान अल्फाज में अगर बात की जाए तो हम खुद इसमें बेसिकली ब्लीडिंग को इंड्यूस करते हैं, अपनी फाइल को एपेक्स से आगे लेके जाते हैं ताकि वो जो है नर्व वेसल्स को टच करे और ब्लीडिंग उसके अंदर आए. जब ब्लीडिंग अंदर आएगी, व्हेन द ब्लड विल फ्लो इनसाइड द कैनाल, इट विल यूजुअली लेड टू फॉर्म फॉर्मेशन ऑफ ब्लड क्लॉट. एंड व्हाट ब्लड क्लॉट विल डू इज ब्लड क्लॉट विल फॉर्म अ स्कैफोल्ड. स्कैफोल्ड बेसिकली क्या होता है, आप कह लें स्केलेटल होता है. स्केलेटन एक आप हम फ्रेमवर्क से कहते हैं, ठीक है, ढांचा सा, ठीक है. वो क्या करेगा, उसके अंदर इन्वेड की जाएंगे सेल्स के साथ, ग्रोथ फैक्टर के साथ, एंड देन इट विल लेड टू अल्टीमेटली फॉर्मेशन ऑफ रीजनरेटिव पल्प. ओके, you can see in this picture that the sealing is done by the tooth by placing a pulp space barrier and permanent coronal restoration. We have placed MT as well. ठीक है, we have placed coronally the restoration as well. It could be GIC or composite anything. What it led, basically the blood clot led to the formation of scaffold in which the cells like fibroblasts, growth factors, etc. invaded and led to the formation of regenerative pulp. You can see this, the root is as well as also regenerated and leads to the formation of root formation. Okay, so what is basically regenerative endodontic procedure by definition? Uh, REPs, biologically based procedures designed to replace damaged pulp tissues with living tissues, restoring normal function. So, as the name indicates, what we are doing is we are replacing the old pulp which was damaged, which was necrotic, with a new living tissue, new living pulp. So basically, we are restoring its vitality with a new pulp and restoring its normal function. And it's basically based on the three main things. As I told you, there's 3S: stem cells, scaffolds, growth factors, or signaling molecules. Okay, 3S. Stem cells basically are extracted from dental pulp, as you see in this picture, but these can be extracted from more places as well. In this picture, you can see there are three main things: stem cells, scaffolds, and growth factors related to the tissue engineering of the tooth. Then, what's basically the ideal case for doing this, performing this regenerative endodontic procedure? Ideal case selection involves some indications, which, if your patient has these things, then you can go towards regenerative endodontic procedures. The indications include immature permanent teeth, open apex, tooth basically which has been erupted into the oral cavity, but it doesn't has apex closed. This is the best ideal case for doing regenerative endodontic procedures. Okay, thin root, it has thin root walls. The pulp, it has pulp necrosis done. Okay, it has periapical lane present. So these all the five indications make your case ideal for performing regenerative endodontic procedures. So common examples include traumatized young incisors, or in carious immature molars, or dense avaginated cases. So you guys can perform the regenerative procedure in such cases. As you can see in this picture, what is being done. The tooth has been this is the permanent incisor basically. Okay, permanent incisor is being erupted into the tooth, but it has open apex. Its root completion is not being done yet. It has thin dentinal walls, and the pulp is being exposed as well, and it might usually get necrosed or inflamed as well. So what are the basically contraindications? किन procedures किन जगहों पे आप basically इसको नहीं perform कर सकते? The roots which are basically fully formed, the elderly patient, okay, in the patients which have root fractures, severely periodontal diseases, and the patient with poor patient compliance. So in these five cases, you can't basically perform regenerative endodontic procedures. Patient age and compliance. This is basically the main important step when selecting a case. The ideal age for performing a regenerative endodontic procedure is basically 8 to 18 years. Okay, why? Because higher stem cell activity in this age. Okay, there is a very much proliferative activity of stem cells during this age. As you all know, this is also a age in which basically we are growing as well. There is a growth spurt as well, so that's why the stem cells are basically very much in highly activity. There is a better healing potential in this age. Okay, patient must attend multiple visits and maintain oral hygiene and avoid biting hard foods. Okay, so biological part of regeneration, as I told you, the regenerative endodontics involves tissue engineering, and tissue engineering is basically on the this basically biological part of three things for the regeneration: what stem cells or progenital cells, uh, growth factors, and scaffold. Missing anyone led to the failure to increase into this failure. Okay, sources of stem cell. Now where we can get stem cells that can lead to the restoring the pulp vitality. The main source basically are stem cells of apical papilla, the stem cells that are present at the apex of the tooth of the pulp. They are basically the main source, you can say, but there are other sources as well, which are basically periodontal ligaments, bone marrow, and dental pulp remnants as well. Okay, and then they can you should know that stem cells basically differentiate into the other types of cells as well, like they can differentiate into fibroblasts, epithelial cells, neural cells, mesenchymal cells. Okay, overall stepwise protocol basically involves these two visits in the periodontal procedure. In the first visit, what you do is you do a diagnosis, you do a minimal instrumentation, you do a disinfection, and do intracanal medicament, and you place a medicament and send the patient. And then in the second visit, what you do is you remove the medicament that you have placed in the first visit. You do a scaffold induction, the biomaterial is placed, and then a coronal seal is done. So you can see in this picture as well. What we did is in the first picture, when the patient came, it had a necrotic pulp. We removed the pulp. Okay, with the filing figure, then we did a irrigation, disinfected it, and then we led to the uh, let the file to the more across the apex to induce the bleeding. But the bleeding, inducing bleeding dirt, it formed a blood clot, and above that we placed MTA and did a filling, coronal seal, and it ultimately led to the pulp regeneration. Stem cells in importance of disinfection. So why disinfection is critical? Why do we do disinfection? Because it removes the necrotic tissue harbors. As you know, no necrotic tissue harbor bacteria. Bacteria inhibit the stem cell survival, and they don't let to basically survive these stem cells that we are placing. Mechanical filing damages thin walls. Okay, so chemical disinfection is preferred whenever you have to do a disinfection of canals. A chemical disinfection with sodium hypochlorite is preferred. Okay, Mechanical preparations, do's and don'ts, what you need to be careful and what you don't need to do when you are mechanically preparing the tooth with the files or with the burr. No aggressive instrumentation. There should be no aggressive instrumentation. Okay, gently filing only if required. Avoid rotary files. Okay, no need to use rotary files in this case. Preserve dentine thickness as much as possible. Acha, which irrigants basically are used? As I said, sodium hypochlorite is the best choice. Its the concentration is basically 1.5 to 3%. High concentration may be toxic to the stem cells, so you need to be very much careful regarding concentration of sodium hypochlorite. Okay, the final irrigant can be 7% EDTA. Why? As you all know that EDTA also helps to remove other dandelion smears or block calcified canals as well. Okay? It releases the growth factors and improves the stem cell attachment. So this is a very much advantage of placing EDTA. Okay, so avoid chlorhexidine. Why? Because it is toxic to stem cells. You all know that chlorhexidine is also basically used as an irrigant, but in this cases, it may cause toxic to stem cells. Okay, so what's basically your example regarding clinical? There is a case of 12-year-old with a necrotic maxillary incisor. What we do is we will do a gentle irrigation with 1.5 sodium hypochlorite. We will finally rinse it with EDTA and no filing is basically done because 12-year-old. Okay, outcome will be favorable regenerative responses in this case. Why intracanal medicaments are placed? Basically, it further reduces the bacteria, it maintains sterile canal environment that we need, and allows the periapical healing place between the visits. Okay, so that's why we have to place the intracanal medicaments. Okay, I hope you guys are like familiar with this thing, triple antibiotic paste, which is basically composition of ciprofloxacin, metronidazole, and minocycline. Okay, so these three are basically given in combination, and a paste is made and is placed into the canal walls. What does the advantage provide? It's basically a broad spectrum. It is effective disinfection, or the disadvantage is basically it led to the tooth discoloration because of the minocycline. Minocycline led to tooth discoloration. Modified TAP and alternatives. So you can replace minocycline with the clindamycin or amoxicillin if you don't want discoloration of tooth. Calcium hydroxide can also be used. It can lead to less discoloration, stem cell is friendly, less effective in heavy infection. Basically, it is not very much effective in inflammatory or periapical conditions. Okay. The placement tips are: place the medicament below the cemento enamel junction, avoid the coronal dentine contact, keep the duration 2 to 4 weeks. So you guys should know that the second visit should be around 2 or 3rd week, okay, after 2 or 3rd week of the first visit, because if you are placing a medicament, okay. Okay, so when we evoke basically bleeding, what it does, it induce cold influence, evokes the bleeding, it leads to the formation of blood clot. Three antibiotics is placed along the root canal, and you can see in the picture that the temporary filling is done. Okay. Okay, so this is a very good thing. Last time we also discussed about all these things. What is basically scaffold? A scaffold is basically provides a structure, supports cells attachment, and allows the tissue in growth. Okay, so you can say it acts as a basically a cell attachment purpose. आसान अल्फाज में अगर मैं समझाऊँ आपको तो ये आपको एक वाइट कलर में एक पिक्चर नज़र आ रही होगी। समझ लें एक इमारत जब हमारी बिल्डिंग्स बनने लगती है तो उससे पहले हम लकड़ी से उसकी ना उसका ढांचा बनाते हैं, फ्रेमवर्क बनाते हैं कि बेसिकली अब यहाँ पे हमने ईंटें लगानी है और इसके ऊपर प्लास्टर करना है। प्लास्टर करने से पहले का जो सारा हिसाब-किताब होता है उसको कहते हैं हम स्कैफोल्ड कह सकते हैं, ठीक है? एक फ्रेमवर्क जब इसके ऊपर बेसिकली हमने जब समझ लें उसके ऊपर हमने लगाई, सीमेंट लगाया और ये सारी ईंटें लगाई तो दे कैन एक्ट एज़ बेसिकली सेल्फ अटैचमेंट इन दिस केस, और आप कह लें फाइब्रोब्लास्ट वगैरह बाकी जो सेल्स हैं उसके ऊपर आके अटैच होंगे और वो पल्प वाइटैलिटी को रीग्रो करेंगे, ठीक है? अच्छा, पल्प ब्लड क्लॉट स्कैफोल्ड की बात की जाए, इससे बेसिकली एक गोल्ड स्टैंडर्ड, ठीक है, प्रोसीजर। बेसिकली इसमें आपने रिमूव करना होता है मेडिकामेंट को, इरिगेट करना है विद द ईडीटीए, ठीक है, ओवर इंस्ट्रूमेंटेशन बियॉन्ड एपेक्स, जान के अपनी फाइल को एपेक्स के बियॉन्ड लेके जाना ताकि ब्लीडिंग इंड्यूस हो, ठीक है। और जब ब्लीडिंग इंड्यूस होगी तो अलाउ करेगा क्लॉट की फॉर्मेशन को। इस तरीके से 5 कैलन स्टेप्स का बेसिकली प्रोसीजर है। एडवांटेज इसका क्या होता है कि इट्स बेसिकली नेचुरल, इट कंटेन्स द ग्रोथ फैक्टर्स, इट इज कॉस्ट इफेक्टिव, ठीक है। मतलब बचत होती है पैसे की, इसमें आपको बाहर से कुछ चीज़ें इंड्यूस नहीं करनी पड़ रही, ठीक है। दिस इज द पिक्चर, आई वुड हाईली अप्रिशिएट कि आप लोग उसका स्क्रीनशॉट ले लें, ठीक है। किस तरीके से बेसिकली आप ये करते हो, ठीक है, अपना प्रोसीजर परफॉर्म रीजनरेटिव एंडोडोंटिक प्रोसीजर करते हो। फर्स्ट अपॉइंटमेंट में बेसिकली आपका पेशेंट आता है, आपने एक्सेस एक्सेस ओपनिंग की उसकी, ठीक है, और उसके बाद आपने वर्किंग टाइम उसकी डिटरमाइन की, ठीक है, कैनाल की प्रेप की जिस तरह आप ट्रेडिशनल रूट कैनाल करते हो। फिर आपने इरिगेशन की, उसकी सिरिंज निडल को आप 1 to 2 मिलीमीटर उससे अबव लेके जाते हो अपने एपिकल एपेक्स से, ठीक है, कैनाल को ड्राई करते हो विद द पेपर पॉइंट, ठीक है, पहली विजिट में आपने सारे स्टेप्स करने हैं, ठीक है, और देन आपने टेम्परेरी सील करना है, ठीक है, उसका एपिकल बैरियर, ठीक है, मेंटल लेवल जंक्शन तक एक मेडिकामेंट प्लेस कर देनी है। इट कुड बी ट्रिपल एंटीबायोटिक पेस्ट, इट कुड बी कैल्शियम हाइड्रोक्साइड, जो भी आपको बेहतर लगे आप इसको कर सकते हैं, ठीक है, लेकिन आपने पहले विजिट में ये स्टेप करनी है। देन आफ्टर 2 to 3 वीक्स आपने फिर पेशेंट को बुलाना है सेकंड विजिट पे, ठीक है, उसमें आपने मेडिकामेंट को रिमूव करना है, कैनाल को ड्राई करना है विद द पेपर पॉइंट दोबारा, ठीक है, ब्लीडिंग को अब आपने यहाँ पे इंटेंशनली इंड्यूस करना है, अपनी एपेक्स फाइल को एपेक्स के बियॉन्ड 2 मिलीमीटर लेके जाना है और ब्लीडिंग इंड्यूस करना है, ठीक है। जब ब्लीडिंग इंड्यूस होगी तो बेसिकली ब्लड क्लॉट की फॉर्मेशन होगी, और फिर यहाँ पे आपने अपना बायो मटेरियल जो है सेरेमिक मटेरियल्स, ठीक है, उनको प्लेस कर देना है, और उसके ऊपर फिर आपने कॉरनल सील मतलब कि गम्बोलेट की रेस्टोरेशन फिलिंग वगैरह जीएसी वगैरह प्लेस कर देना है, ठीक है। अच्छा, तो प्लेटलेट्स बेस्ड स्कैफोल्ड बेसिकली क्या है हमारे पास कि पीआरपी या पीआरएफ भी आप इसमें रोल प्ले कर सकती हैं, लेकिन ग्रोथ फैक्टर्स होते हैं आपको पता होना चाहिए, ठीक है, हमारे प्लेटलेट्स दे डू अ फास्टर हीलिंग, बेटर कंट्रोल होता है। डिसएडवांटेज का ये है दे आर लिटिल बिट कॉस्टली, ठीक है, एंड ब्लड डोंट रिक्वायर्ड, मतलब आपको निकालना पड़ता है अपनी वेन्स वो आर्टरीज वगैरह से ब्लड, ठीक है। तो पर्पस ऑफ बायोमटेरियल्स का बेसिकली क्या होता है कि ये सील करते हैं स्कैफोल्ड को जो आपके पास आया होता है, जैसा ब्लड क्लॉट में ब्लीडिंग की वजह से आया था, तो प्रिवेंट करता है बैक्टीरियल लीकेज को एंड प्रमोट करता है बायोकम्पेटिबिलिटी को, ठीक है, आप इस पिक्चर में देख सकते हैं, ठीक है। तो इसके ऊपर बेसिकली उन्होंने प्लेस किया है बायोमटेरियल, ठीक है, सील कर दिया, ठीक है, और ये ग्रोथ फैक्टर को इंडक्शन को रोल प्ले कर रहा है। कॉमनली यूज मटेरियल हमारे पास कौन कौन से हम इसमें प्ले यूज करते हैं, ठीक है, वो हमारे पास एमटीए आता है, ठीक है, जिसको जिसको हम गोल्ड स्टैंडर्ड के तौर पे यूज करते हैं, ठीक है, मिनरल टाई ऑक्साइड एडिटेट, और इसकी एक्सलेंट शीलिंग होती है, डिस्कलरेशन रिस्क होती है, ठीक है। पहले हम करते थे कैल्शियम हाइड्रोक्साइड, बस अब हमने ज़्यादातर एमटीए यूज करना शुरू कर दिया, ठीक है। फिर बायोडेंटीन है हमारे पास, बायोडेंटीन जो है आजकल फास्टर सेटिंग उसकी होती है, लेसर डिस्कलरेशन है, गुड बायोकम्पेटिबिलिटी है, बायोसेरेमिक्स में हमारे पास बायो एक्टिव है और एस्थेटिक फ्रेंडली है। प्लेसमेंट प्रोटोकॉल की बात करें तो हम मटेरियल को है प्लेस करते हैं ओवर द स्कैफोल्ड, ठीक है, जो भी हमारे पास होता है, ठीक है, और थिकनेस जो होती है इसकी 3 to 4 मिलीमीटर रखते हैं, अवॉइड करते हैं प्रेशर ऑन क्लॉट, ठीक है, फॉलो विद द परमानेंट रिस्टोरेशन, जो भी है इसके फॉलोअप करते हैं, इसके प्लेस करने के बाद अगर फर्स्ट जीआईजी को प्लेस किया है या आपने एमटी को प्लेस किया, इसके ऊपर फिर आप अपनी जो फिक्स रिस्टोरेशन है वो करेंगे, ठीक है। फिर ये करने के बाद एक कॉर्नल सील आ जाएगी, जब कॉर्नल सील आ जाएगी तो वो कॉर्नल सील बेसिकली वेरी मच क्रिटिकल फॉर सक्सेस, अगर ये नहीं होगा तो आपका फेल हो जाएगा रीडोंडेंट प्रोसीजर, ठीक है। इट कुड बी प्रोवाइडेड विद द हेल्प ऑफ ग्लास आइनोमर बेस्ड कंपोजिट रेस्टोरेशन, या uh, जो कि बेसिकली करेंगी अल्टीमेटली प्रिवेंट करेगी माइक्रो लीकेज को, ठीक है। एक्सपेक्टेड आउटकम्स की अगर हम बात करें तो बेसिकली हम इस पूरे प्रोसीजर के बाद हमारा क्या एक्सपेक्टेड आउटकम्स क्या होना चाहिए कि रेजोल्यूशन होना चाहिए सिम्टम्स के, अगर पेशेंट आया था आपके पास नेक्रोटिक पल्प के साथ या इन्फ्लेमेशन के साथ तो वो उसका खत्म हो जाएगा, हीलिंग और पेरिपियल लाइन हो जाएगा, अगर पेरिपियल लाइन कोई बनी हुई थी इंक्रीज उसकी रूट लेंथ हो जाएगी, बेसिकली पहले उसकी एज बताया कि इसके सबसे बेहतरीन प्रोसीजर्स होते हैं इमेच्योर टूथ या वो जिनकी बेसिकली जो रूट्स होती हैं अभी फॉर्म फुली नहीं होती, ठीक है, तो उसमें एपेक्सिफिकेशन कर देगा, एपेक्स को क्लोज कर देगा, रूट्स की जो थिन वॉल्स हैं उनको थिकन कर देगा डेंटिनल वॉल्स को, ठीक है। पॉसिबली पॉजिटिव वाइटलिटी रिस्पॉन्स, पहले अगर पेशेंट आपके पास नेक्रोटिक पल्प के साथ आया तो अब यहाँ पे आएगा विद द पल्प वाइटलिटी बीइंग रिस्टोर्ड, ठीक है। ये पिक्चर बड़ा जबरदस्त है, इसको देख लें दफा के इरिवर्सिबल इन्फ्लेम्ड और नेक्रोटिक टीथ के साथ पेशेंट आया, उसमें आपने रूट कैनाल डिसइंफेक्शन की, ठीक है, एंड एनलार्जमेंट ऑफ एपिकल फोरामेन, ठीक है। फिर आपने रीजनरेटिव एंडोडोंटिक्स प्रोसीजर को परफॉर्म किया बाय ग्रोथ फैक्टर एंडोनिनस सेल्स एंड स्कैफोल्ड्स, मतलब टिश्यू इंजीनियरिंग की, which ultimately led to the regenerative pulp-like tissue, dental composite, MTA plug, connective tissue cementum. Okay. फॉलोअप स्केड्यूल आपने करना है 3 months, 6 months, 12 months, ईयरली देयर आफ्टर, ठीक है। तो कोशिश करनी है कि फॉलोअप आपका स्केड्यूल हो 3 months, 6 months, 12 months, ईयरली देयर आफ्टर, ठीक है। रेडियोग्राफिक एवेल्यूशन इज मैंडेटरी, ठीक है, रेडियोग्राफ्स आपने ज़्यादा कराते रहने हैं। कम कॉमन कॉम्प्लिकेशन जो इसके साथ होती हैं वही होती हैं बेसिकली, जो पेशेंट को बताया ना कि डिस्कलरेशन का होता है कि वो माइनोसाइक्लिन की वजह से डिस्कलरेशन हो जाता है, पहले एंटीबायोटिक पेस्ट यूज़ करते हैं तो नो ब्लीडिंग इज बेसिकली इंड्यूस, ठीक है, और परसिस्टेंट इन्फेक्शन हो सकता है पेशेंट को, ठीक है। कैनाल कैल्सिफिकेशन, इसलिए कहते हैं ईडीडी को आप प्लेस करें ताकि कैनाल की कैल्सिफिकेशन दूर हो और उसकी ग्रोथ फैक्टर की अटैचमेंट हो, ठीक है। क्लिनिकल टिप्स फॉर सक्सेस क्या है? बेसिकली केस सिलेक्शन इज द की। जितना अच्छा आपका केस होगा, सिलेक्शन होगा, उतना ही आपका आउटकम भी अच्छा आएगा। जेंटल डिसइंफेक्शन करें, स्टेम सेल फ्रेंडली इरिगेंट्स को यूज करें, ठीक है। अगेन डोंट यूज क्लोरहेक्सिडिन, ठीक है, इट्स साइटोटॉक्सिक टू द सेल्स, ठीक है। और अगर आप दूसरा भी यूज कर रहे हैं अपना नॉर्मल सोडियम हाइपोक्लोराइड, तो उसकी कंसंट्रेशन जो आपने 1.5 to 3% रखनी है, उससे ज़्यादा नहीं रखनी, ठीक है, अदरवाइज वो भी फिर डैमेज करेगा, ठीक है। और 17% ईटीए को यूज़ करें। अवॉइड ओवर इंस्ट्रूमेंटेशन, देयर इज नो नीड टू बेसिकली डू ओवर इंस्ट्रूमेंटेशन, ठीक है। परफेक्ट कॉर्नर सील बेसिकली इज द क्रूशियल स्टेप फॉर सक्सेस। समरी बेसिकली आज की अगर हम बात करें तो यही थी कि रीजनरेशन रिस्टोर्स बायोलॉजी, ठीक है, नॉट जस्ट स्ट्रक्चर, ठीक है। ये ना सिर्फ स्ट्रक्चर को रिस्टोर करता है, मतलब कि एपेक्स एक्सप्रेशन को लीड नहीं करता, बल्कि पल्प की वाइटलिटी को रिस्टोर करता है, उसकी बायोलॉजी को रिस्टोर करता है, ठीक है। डिसइंफेक्शन जो है इज द फाउंडेशन। डिसइंफेक्शन आपने करनी है लाजमी। स्कैफोल्ड एंड बायोमटेरियल सपोर्ट हीलिंग, ठीक है। और पेशेंट सिलेक्शन डिटरमाइन द सक्सेस। तो पेशेंट सिलेक्शन जो है उसकी, जैसे मैंने एज बताई, 8 to 18 ईयर्स ऑफ एज, दिस इज अ वेरी गुड एज। अगर आपके पास इस एज में कोई पेशेंट आता है विद एनी परमानेंट इमेच्योर टूथ, ठीक है, जो कि इन्फ्लेम्ड हो या फिर कह लें नेक्रोटिक पल्प के साथ आए, तो दिस इज अ वेरी गुड कैंडिडेट, ठीक है, टू परफॉर्म दिस प्रोसीजर, ठीक है। टेक होम मैसेज आज का ये है: regenerative endodontics transform immature necrotic teeth from hopeless to hopeful, ठीक है। तो देख लें कितना इससे बड़ा फायदा होता है, ठीक है। So this was today's webinar. I hope it was fruitful and productive to you guys. Thank you very much for listening it. If you guys have any question, please feel free to ask in the chat box.
Thank you so much, Dr. Farooq, for that truly enlightening and well-structured presentation. Your explanation of regenerative endodontic procedures from the biological basis to a clinical execution was both comprehensive and highly practical. It certainly highlighted how regenerative concepts are reshaping the future of endodontics. We'll now move on to the Q&A session. I invite the audience to post their question in the chat box and I'll read them out for Dr. Farooq. The feedback form, a gentle reminder to fill out the feedback form that will appear on your screen. Certificates will be given only to those who will fill the feedback form.
Dr. Sania, if you have any question, please tell. Okay, I can see one question here. Dr. Ishaq says, why is over instrumentation avoided in the regenerative endodontics? Okay, so there, as I told, there are two visits basically in the regenerative procedures. In the first visit, what you do is you remove the inflamed pulp. Okay, the pulp, necrotic pulp, basically the pulp which has been already dead. In terms of removing that pulp, if you do over instrumentation, what we will do is you will damage already thin dentinal walls more, which will lead to a very much damage to them, and that can't be reversed. Okay, so you need to be very much sensitive regarding your instrumentation when you are doing in the first step, and in the and in the second step. In the first step, if you or, unintentionally move your file more than two millimeter below the apex, okay, it will lead to the blood formation in the first step, which you don't require in the first step. Okay, so you need to be very much careful regarding when to induce bleeding intentionally. Okay, so then you will be placing 2 millimeter below the file. That's why there is no need to for over menstruation. You need to be careful. Okay, in the second step, you intentionally uh, make the your apex below the file of 2 millimeter, take it below the apex, and then the bleeding is induced, and we need it by because we have to form a blood clot, which will act as a our scaffold, and then the regenerative procedure will be moved forward. Okay, I hope your query is being answered. uh, okay, Give me 1 minute, Dr. Sania. I will share it. Just 2 or 3 minutes. Okay. In the meanwhile, you guys can please ask the questions as well, and Dr. Sania, you can read them out for me so that I can see the link and share it to you guys.
So we have one question from Drisha. Why is minocycline avoided nowadays in triple antibiotic paste?
Why is sorry, I you can repeat that question.
Why is minocycline avoided nowadays in triple antibiotic paste?
Okay, so minocycline basically what it does is it led to the discoloration of the tooth. Okay, that's why it's being avoided. I have also mentioned this in my slides as well. Okay, just a minute, guys. Your this is a comment. Okay, let me know you guys can see the chat. See the feedback form. Okay, anyone has any another question? Please feel free to ask. That's good. अच्छा इसके बाद हमारा इंशाल्लाह नेक्स्ट वेडनेसडे को आई गेस 31 दिसंबर इफ आई एम नॉट रॉन्ग लास्ट सेशन होगा, ठीक है। और हम इसकी जो है बात करेंगे, ठीक है, इसके लास्ट सेशन पे। तो देन द सीरीज विल रैप अप। सो आई वुड हाईली अप्रिशिएट यू गाइस टू अटेंड दैट एज वेल। डॉक्टर सानिया, let me know if there is another question or should we conclude the session today?
Yes, there's no question at the moment. We'll wait for 5 minutes. If nothing comes, then we'll conclude the session.
Okay. So the next session is basically okay, so next session is basically on outcomes, case studies, and future directions. The topic is clinical outcomes and emerging trends in regenerative endodontics. I also have a paper published on this topic as well. The focus will be on the case discussions, success, failure analysis, long-term prognosis, and research updates and innovation. And it would be on the Wednesday, 31st December, 7 to 8 p.m. ठीक है, I guess 5 minutes हो गए हैं, Dr. Sania. We should conclude now.
Okay, since there are no questions, we are concluding the session. Dr. Farooq, would you like to add anything?
No, thank you very much. Just I would suggest कि इसका लास्ट सेशन वेडनेसडे को है, नेक्स्ट वेडनेसडे को आप लोग वो भी अटेंड कर लीजिएगा।
Thank you once again, Dr. Farooq, for sharing your expertise and clinical insights with us today. And a heartfelt thank you to all our participants for attending and actively engaging in the section. We hope today's webinar has enhanced your understanding of regenerative endodontic procedures and inspired you to incorporate these concepts into your clinical practice where appropriate. Before we conclude, a gentle reminder to please complete the feedback form that will appear on your screen. Your feedback is extremely valuable and help us to improve future educational sessions. Stay connected with us for our upcoming webinars, and until then, keep learning, keep evolving, and take care. Have a wonderful day.
ठीक हो गया, थैंक यू वेरी मच एवरीवन, अल्लाह हाफिज़।